Hi everybody, Neil Kravitz here. Hope you're enjoying these daily clinical pearls. I received a great email from someone who attended one of my lectures on the open exposure technique. And the email was that the oral surgeon was reluctant to do an open exposure, simply not place a gold chain. They wanted to do a closed technique with a gold chain. And my response was that is very normal, and it's not uncommon for you to make a request for an oral surgeon to do an open exposure, and they simply say that's not what I want to do. This could even be extracting a canine tooth. So there's a lot of times when you'll refer to an oral surgeon and they will say no. And my response to that is, that's fine. You just simply need to find an oral surgeon who is willing to learn these techniques, a surgeon that you can cultivate, because for an open exposure, really canine exposure in general, and also for molar uprating, mesial, angular, mandibular second molars, you're only going to want to work with maybe one or two oral surgeons, no one else. So I have surgeons who are great at orthognathic surgery. I have some oral surgeons who are really great at treating nervous children. And I have one or two surgeons who I prefer for canine exposures and molar uprating. Really, I have a top choice, and I really ask patients to go to that one surgeon. So for these challenging techniques that are challenging for the orthodontist, I really rely on the surgeon to make the orthodontics easy. And I am certainly okay if a surgeon does not feel comfortable doing a technique that I need them to do. I just simply won't use them for those techniques, and I'll use them for other surgeries. So my pearl here is that for canine exposure, and even sometimes canine extraction, and mandibular molar uprating, I think you should just use one oral surgeon that you work well with, that communicates well with you, that has really become a subspecialist at that technique. And I think you can use those other great oral surgeons in your neighborhood for extractions of premolars or wisdom teeth or orthognathic surgery. Let me know what you think about this pearl. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.